The Healthcare Labyrinth Podcast is back for another episode. Join Marc S. Ryan, a veteran health plan and health technology executive, as he explores the world of healthcare.
Welcome, everyone, to the Healthcare Labyrinth Podcast. My name is Marc Ryan, and thanks to everyone for listening in. Today, we're diving into something that is dense, controversial, and potentially transformational: the Trump administration's proposed 2027 Affordable Care Act exchange rule. It's 195 pages, small font, and it represents what I would call a structural reset of the ACA marketplace philosophy. This is not tinkering at the edges. This is not administrative housekeeping. Our title to today's podcast says it all: the 2027 ACA Exchange Rule, Structural Reset or Risky Gamble. The rule is a direct challenge to the Obama and Biden framework that emphasized standardized benefits, rich actuarial value, and heavy subsidies. And whether you love it or hate it, this rule is a shot across the bow of the current exchange model. But is it really a structural reset or a risky gamble? Let's break it down. Let's get to segment one, the Obama-Biden framework, hopelessly devoted. If I had to describe the Obama and Biden approach to the exchanges, I'd borrow from Greece and one of my beloved singers growing up, Olivia Newton-John, who sang "Hopelessly Devoted to You." Obama and Biden were hopelessly devoted to standardized benefits, limited plan variation, rich actuarial value, strong consumer protections, generous premium subsidies. Now, let me say something clearly. I have supported the exchanges and Medicaid expansion in the ACA from the beginning. I believe in affordable universal access. Medicaid expansion has been cost-effective. Community rating drives up premiums, yes, but it ensures everyone can get covered, even the sick. That matters. But I've always taken issue with something else: the relentless push toward richer and richer benefit designs. Every mandate, every actuarial tweak, every cost-sharing enhancement, they all add costs. And what did we do when premiums rose? We subsidized more. At this point, roughly 92% of exchange enrollees receive premium subsidies. During COVID, subsidies were enhanced. People over 400% of the federal poverty level became eligible. That fixed a major flaw, and I supported it. But here's the uncomfortable truth: enhanced subsidies mask the underlying cost problem in the exchanges and in healthcare in general. Free or near-free premiums, that drives enrollment. It also arguably drove improper and fraudulent enrollments. When something costs nothing, the system gets gamed. And now the enhanced subsidies are gone. They couldn't last forever. Sure, Congress could extend them again, and you can make a case that something should have been done. But doing so would continue to paper over the fundamental issue. We are operating a very high-cost insurance structure in a very high-cost healthcare system via the Affordable Care Act. That goes for the exchanges with over 23 million people in them, but also for the broader employer coverage market, where over half the population, or over 60% of working-age adults, receive coverage. That's nearly 170 million people. And here's the kicker about all this. Despite the good the ACA did and still does in terms of covering some 40+ million people, many of these very people who gained coverage are now underinsured. High deductibles, high out-of-pocket maximums, high coinsurance. They're technically insured, but functionally struggling to use their coverage. That's the backdrop. With that, we will take our first break, and when we get back, we will jump into Trump's paradigm shift. Be right back.
Health plans and insurance are confusing. Our healthcare system is in dire need of reform. Health policy expert Marc Ryan tackles both issues in his book, The Healthcare Labyrinth. It is both a guide to navigating health plans and fixing American health insurance. Marc dives deep into how health plans and the American health insurance system operate. He then outlines a comprehensive reform agenda for the system as a whole, including pricing, emphasizing health and care management, and ensuring affordable access to health coverage in a private delivery model. Marc is a bit of an unconventional Republican in that he believes affordable access is the morally right thing to do, and that it is also fiscally prudent for our nation. Learn more about Marc's book, The Healthcare Labyrinth, at healthcarelabyrinth.com or search at leading bookseller websites. Available in print, ebook, and audiobook forms.
Welcome back, and we hope you are enjoying this episode of the Healthcare Labyrinth Podcast. I am Marc Ryan, and thanks for listening. We are talking all about the seismic changes the Trump administration wants to make to the ACA and the exchanges. Let's get to segment 2. The Trump paradigm shift, a structural reset. Under Trump 45, we saw the beginnings of a different philosophy. Under Trump 47, it is becoming much clearer. The shift is this: instead of subsidizing richness, reduce the richness. Instead of gold-plating benefits, lower premiums. Instead of standardizing design, encourage variation and innovation. That's the reset. We've already seen several steps in this direction before this recent ACA exchange rule was proposed for 2027. Let's talk about them. ICRAs, individual coverage health reimbursement arrangements. Employers can fund employee purchase of exchange plans. This allows smaller employers to fix their costs, move employees towards silver, bronze, or catastrophic coverage, and exit traditional group coverage to insulate themselves from rising costs. It's portability plus cost control. Critics say it fragments risk pools. Proponents say it modernizes employer coverage. My criticism is that it is still built somewhat on the rich mandates and coverage of the ACA. Number 2, HSAs tied to bronze and catastrophic plans. This encourages lower premiums with tax-advantaged savings accounts known as health savings accounts for care before the deductible. Consumer skin is in the game. There are lower premium structures and long-term savings vehicles. Again, critics say this favors the healthy and to some degree the wealthy. And number 3, the advent of direct primary care, now financeable through health savings accounts. The DPC is a subscription model for primary care. That's lower overhead, direct access, often no insurance building. This pushes a primary care first philosophy. And now the 2027 rule takes all these concepts even further. So let's get to segment 3, what the 2027 rule actually does. Let's get into specifics. First, we have the elimination of standardized plan requirements. The rule removes the limit of 2 non-standard plans per metal tier and the requirement to offer standardized plans. Translation, insurers can innovate again. Critics say this will confuse consumers. And yes, more variation means more complexity. But let's be honest, standardization also froze innovation. It limited experimentation. Are we protecting consumers or are we protecting regulatory design? That's the big debate on number 1. Let's get to number 2, more flexible benefit structures. The proposed rule would lower deductibles paired with higher out-of-pocket maximums. Adjustments to cost-sharing parameters would also occur in bronze and catastrophic plans. The goal is to lower premiums, but the trade-off, potentially higher exposure at the top end. From an actuarial standpoint, this will likely increase premiums in platinum, gold, and silver plans. Why? Healthier individuals may migrate to leaner plans. Sicker enrollees remain in richer tiers. Risk concentration then increases, but subsidies will absorb some of that impact. So the question becomes, is it better to have more segmented but affordable options or fewer standardized but increasingly expensive ones? Will insurers benefit by having more people staying in the risk pool overall or coming to it even with leaner coverage? Let's get to number 3, multi-year catastrophic plans. This is huge. Insurers could offer catastrophic coverage in 1-year terms or up to 10-year terms, with the ability to incorporate value-based insurance design for multi-year terms. That means covering preventative services beyond what's required pre-deductible today. The pitch: younger and healthier enrollees lock into long-term catastrophic coverage, stable premiums, predictable catastrophic coverage, primary care infusion. Critics are warning, though, this again could make richer plans more adverse and risk pools fragment even further. But here's the counter. Stability matters. Premium shock is destabilizing. Long-term catastrophic coverage offers predictability in an unpredictable system. It is attractive to younger folks who want cheaper coverage and perhaps more innovative approaches. Let's get on to change 4 here. Catastrophic plans for more people over 30. This is currently limited and now would be expanded. It's again cheaper premiums and thinner coverage. Critics say this undermines comprehensive coverage, but supporters say some coverage is better than no coverage. And this is where it gets controversial. Are we obsessed with comprehensiveness to the point that we price people out of insurance? Let's get on to topic 5. More non-traditional network designs as qualified plans in the exchanges. This one has critics apoplectic. The rule would allow innovative non-network plans to qualify as exchange plans if they demonstrate sufficient provider access. But will these be really no coverage plans? They would set specific benefit amounts, communicate those amounts clearly, allow enrollees to seek care from any provider, and ensure enough providers accept the payment as payment in full. This is essentially reference pricing meets transparency. Critics argue again, these aren't real insurance plans. But ask yourself, if a plan pays a defined benefit amount, guarantees catastrophic protection, and ensures access, is that not insurance? Or is it just different insurance? This could be the most radical shift in the proposed rule. While I am skeptical of these lean plans, there seems to be at least some restrictions on what will and will not be deemed qualified coverage. This is a step in the right direction for the Trump administration from earlier policies that had an unfettered approach to this kind of framework. With that, we will take our second break, and when we get back, we will tell you where I land on all this. Be right back.
Lilac Software is proud to work with the Healthcare Labyrinth website to educate people on the healthcare system. At Lilac, we believe transparency is so important in healthcare. The healthcare system is opaque, and Lilac is trying to bring clarity to data and unleash the best member care, reduce costs, and improve outcomes. Our cloud-native payer platform revolutionizes data insights and analytics. Plans have all the data they need, but in silos locked away in point solutions. At Lilac, we solve the data fragmentation problem and help plans turn complex data into actionable insights, leading to greater operating leverage, tight cost controls, and healthier members. Health plans can improve STAR scores, reduce medical expense, drive revenue, and more. Quite simply, with Lilac, you can drive better business and health outcomes. Learn more at lilacsoftware.com.
Welcome back, and we hope you are enjoying this episode of the Healthcare Labyrinth Podcast. I'm Marc Ryan, and thanks for listening in. We are talking about the seismic changes the Trump administration wants to make to the ACA and exchanges through the 2027 proposed rule. Let's get to segment 4, where I land and why this is hard. Let me be blunt. There will be fallout to all these changes. Premiums and richer tiers on the exchanges likely rise. Risk segmentation increases. Exchange plans will face disruption. But we must confront something uncomfortable. The current trajectory, even with subsidies, is creating more underinsured Americans, and it hasn't moved the uninsured rate for some time in the right direction. It shows the flaws in the current ACA and exchange system. Gold-plated design does not equal accessible care, and we can't pretend enhanced subsidies were a permanent solution. The GOP approach is political, yes, but it also responds to 2 real policy trends. Trend 1, unaffordability, as I said, everywhere. Employer family coverage is nearing $27,000 annually. That has nothing to do with exchange subsidies, but the overall design and mandates of the ACA system. That's systemic cost growth that is choking Americans, businesses, and the government. We cannot subsidize our way out of structural inflation. Trend 2, a generational shift. Younger Americans do not want mom and dad's insurance model. They want digital access, transparent pricing, primary care relationships, flexibility, and optionality. Even seniors are pursuing personalized care trends. Peptides, GLP-1s, cosmetic services, hair loss treatments. All these services are in demand. Insurance is no longer just about hospitalization risk. It's about personalized care. The ACA framework was built in 2010. Healthcare consumerism in 2026 looks very different, just a decade and a half later. Let's move on to segment 5, the middle ground that no one is talking about. If both parties were smart, they would do the following. First, fix subsidies rationally, including fair treatment and subsidies for those above 400% of poverty. Second, guard against improper enrollments. Third, ensure premium contributions for everyone, even a minimal amount per month for the poorest so that everyone has skin in the game. Fourth, attack price growth directly with price reform. Fifth, reinvigorate primary care. Sixth, modernize benefits for digital first generations. And seventh, test consumer-driven approaches and reference pricing seriously. And let's be clear, the rule does not eliminate guaranteed issue. It does not remove pre-existing condition protections. Consumer protections remain intact. This is not a repeal, it is a redesign. The Democrats are misleading on this. With that, we will take our last break, and when we get back, we will wrap all this up. Be right back.
The Healthcare Labyrinth is no ordinary website. It features news and commentary from one of the nation's leading healthcare policy and technology experts. Marc Ryan combs the internet for the latest healthcare news and publishes a news feed each weekday with summations and Marc's insights. Twice a week, Marc publishes a blog to go deep into a current issue. And of course, Marc hosts a podcast each week to delve even further. All of this is available at healthcarelabyrinth.com. Visit each day for the latest happenings in healthcare. As well, learn more about Marc's book, The Healthcare Labyrinth, at the website. That's healthcarelabyrinth.com, your go-to source for healthcare news.
Welcome back, and we hope you're enjoying this episode of the Healthcare Labyrinth Podcast. I am Marc Ryan, and thanks for listening in. We are talking all about the seismic changes the Trump administration wants to make to the ACA and the exchanges. Let's get to my final thoughts, our last segment, reform or retreat. Critics say this is a dismantling. Supporters say this is modernization. I say this: we cannot continue layering subsidies onto a structurally expensive system and call it reform. At some point, you either change the product or change the prices. Preferably, I would do both. The 2027 ACA Exchange rule is not perfect. It will create disruption. It will create political firestorms. But it is responding to two realities: uncontrolled cost growth and changing consumer expectations. If comprehensiveness means unaffordability, if gold plating means underinsurance, if standardization means stagnation, then maybe, just maybe, it's time to test a different approach. That doesn't mean abandoning coverage goals or protections. It means redefining how we achieve them. This is a structural reset. The question isn't whether it's controversial. The question is whether standing still is more dangerous. With that, we will conclude this edition of the Healthcare Labyrinth Podcast. Thanks for listening in. I am Marc Ryan. We'll continue to unpack the 2027 ACA rule as it evolves. Stay informed, stay skeptical, and stay engaged. See you next week. Take care.
Thanks for joining Marc and the Healthcare Labyrinth Podcast. Go to healthcarelabyrinth.com each day for the latest healthcare news. See you next week on the next Healthcare Labyrinth Podcast.